Welcome to another episode of Bark Brigade Podcast by Dogazilla Magazine. You know, it's a moment that I think every single dog owner dreads. Your vet, who you trust completely, tells you your dog needs a procedure and it's going to require general anesthesia,
hmm
and your heart just sinks. It could be for something major, like fixing a torn ligament, or something that feels routine like a dental cleaning. But that word anesthesia just brings up so much
It
anxiety.
really does.
Yeah.
And that anxiety, it's completely understandable. But what our research shows and what the source material we're looking at today makes really clear is that most of that fear comes from not knowing what modern veterinary medicine actually looks like
Yeah,
today.
exactly.
And that's why we're doing this deep dive. We're going to break down an essential guide on veterinary anesthesia for dogs. We'll be looking at, the real safety measures, what the risks actually are, and the crucial steps for preparation and recovery.
Right.
Our whole mission here is to give you, the listener, the knowledge you need to turn that nervousness into confidence so you can make really informed decisions for your dog.
So it all comes down to that one core question that I think every owner asks. Is anesthesia safe for my dog? And the source material, it gives a short answer.
It
And that
is.
answer is yes. Overwhelmingly yes, but with a huge caveat. It's safe when it's managed by a qualified team. The real key here isn't just the drug, it's the entire process. It's the prep, the monitoring during the procedure, and the aftercare. Okay, so let's unpack that foundation first.
Let's do it.
So, part one, anesthesia 101. What are we even talking about when we say anesthesia in a vet clinic?
Well, it's a lot more than just, putting a dog to sleep for a bit. It's a very controlled process.
Yeah.
We're talking about administering specific medications to achieve three things all at once: pain relief, sedation, and total unconsciousness.
Okay, so three distinct goals.
Three goals.
Yeah.
The whole point is to make sure the dog feels absolutely no discomfort, no fear, no anxiety at all during the procedure. It's about their well-being from start to finish.
So, this is that state of controlled unconsciousness. The source talks about general anesthesia, which is what's used for the big stuff. It induces a complete loss of sensation by affecting the central nervous system.
Exactly. It temporarily and safely switches off those awareness centers.
Hmm.
And how we deliver it is also part of the safety protocol. It's usually done in two stages.
2 stages.
Yeah. First, there's what we call induction. That's often an IV injection that makes the dog lose consciousness very quickly and smoothly. Then comes the maintenance phase, where we keep them in that state, usually with an anesthetic gas.
Like the ones you hear about, isoflurane or sevoflurane.
Precisely. Those are delivered through a tube in the windpipe.
Uh-huh.
And the great thing about these modern gases is that we can adjust the depth of anesthesia literally second by second. It gives us incredible control and allows for a much quicker, smoother wake-up.
Okay, that makes sense. So not every procedure needs that same deep level of, general anesthesia. The source breaks it down into different types, right?
Yes, and this is a key point. There are basically three categories. First, like you said, is general anesthesia. This is for complete unconsciousness, total muscle relaxation. It's non-negotiable for any major surgery spaying, neutering, orthopedic repairs, and importantly, for thorough dental cleanings.
We'll definitely come back to the dental cleanings. What's the second type?
Second is local anesthesia. This is where we just numb a specific area. Think of it like when you go to the dentist and they numb one tooth. The dog is awake, but that one spot is completely desensitized.
So for like a small skin lump removal or something?
Exactly. Or, and this is really important, we often use it with general anesthesia. It's called multimodal pain management. If we can block the pain locally, we can use a lower level of the general anesthetic gas, which makes the whole procedure even safer and recovery much more comfortable.
That's a great point. And the third type?
The third is sedation. This is a much lighter approach. The dog's just very relaxed and drowsy, but not fully unconscious. We'd use this for things like x-rays on a nervous dog or treating a minor wound. It avoids the full commitment of general anesthesia when it's just not needed.
So it seems like a huge part of the safety is just choosing the right tool for the job.
That's the first step. And the second, which is maybe even more critical, is the prep work that happens before any drugs are even drawn up.
Right, the pre-anesthetic assessment. The source really hammers this home. It says modern vet practices have moved way beyond a one-size-fits-all approach. Every single protocol is tailored.
It has to be.
Yeah.
Tailored to the dog's age, breed, weight, and their specific health status. And that tailoring all starts with a really detailed assessment.
And that assessment has 3 main parts, as I understand it.
3 core non-negotiable parts. The first is a really comprehensive physical examination. The vet listens carefully to the heart and lungs. They're looking for murmurs or arrhythmias or any sign of breathing issues because the heart and lungs are doing the heavy lifting during anesthesia.
Okay, so that's the hands-on part. Then comes the part that I think a lot of owners get a bit wary of, the blood tests.
The pre-anesthetic blood work.
Yes, it can feel like an extra cost, especially if your dog seems perfectly healthy. So why is this blood work so vital?
That is such a critical question. And the answer is all about how the dog's body gets rid of the anesthetic drugs. It's all about metabolism.
Okay.
The drugs are broken down primarily by the liver. Then, the waste products are flushed out by the kidneys. The blood tests tell us exactly how well those two organs are working.
So it's like a roadmap for the drugs.
It's the perfect roadmap. If the blood work shows, say, elevated liver enzymes, we know that dog will break down the drugs more slowly. If it shows high kidney values, we know they'll have trouble clearing the drugs from their system.
And if that happens?
The drugs hang around for longer, the recovery is rougher, slower, and the risk of complications goes way up. But if we know about that sluggish liver or kidney function beforehand, we can change the whole plan. We can choose different drugs that are kinder to those organs. We can adjust the dose. We can give them extra IV fluids to support their kidneys. It turns a potential crisis into a simple, manageable adjustment.
That makes so much sense. It's not just a screening test, it's proactive risk management. And the third part of the assessment
Is the medical history review. And this is where you, the owner, play a massive role. We need to know everything.
everything.
Any pre-existing conditions, sure, but also every single medication or even supplement the dog is on. A lot of common drugs can interact with anesthetics, affecting things like blood pressure or clotting. Honesty and completeness here are an essential part of the safety net.
So when you put all three together, the physical exam, the blood work roadmap, and the medical history, you get this incredibly detailed picture of that one specific dog.
Exactly. And that is what allows the vet to build a truly customized and therefore truly safe anesthetic protocol from the ground up.
Okay, let's shift gears and talk about one of the procedures that, as we mentioned, causes a lot of this anxiety, the dental cleaning. I think we've all heard the question, does my dog really need to go under for a simple teeth cleaning?
All the time. And the answer from every veterinary standard is an absolute, unequivocal yes. And the reasons go so much deeper than just, keeping the dog still.
Right, because obviously you can't just ask them to open wide and hold still for an hour.
Of course not. But it's what happens during that hour that matters. A real professional dental cleaning isn't just scraping the stuff you can see. The real danger, the periodontal disease, is hiding below the gum line.
So you have to get under the gums.
You have to. We use specialized tools to clean out those pockets where infection lives. We take dental x-rays because about 60% of the tooth is invisible, hidden in the jawbone. We have to polish the teeth to prevent plaque from sticking again.
And trying to do any of that on a dog that's awake would be...
It would be impossible, painful, incredibly stressful for the dog, and frankly, unsafe for everyone involved. It just wouldn't be effective. You'd miss the entire point of the procedure.
And the source material is very clear that ignoring that need, skipping those cleanings, can have really serious consequences that go way beyond just bad breath.
Oh, absolutely. It's a direct link. Poor oral hygiene leads to plaque, then tartar, then gum disease. And the bacteria in those infected gums don't just stay in the mouth.
They get into the bloodstream.
They get into the bloodstream every single day. And from there, they travel all over the body. It's a chronic source of inflammation.
And they can cause damage to major organs, right?
Yes. The source highlights this very clearly. Those bacteria often lodge on the valves of the heart, causing serious heart disease, or they get filtered out by the kidneys, causing long-term kidney damage. So a dental cleaning isn't cosmetic. It's a medical necessity to protect their whole body.
Okay, so anesthesia is what allows for that truly comprehensive deep cleaning, the scaling, the polishing, and if needed, pulling a bad tooth without any pain.
Precisely. It makes a critical procedure safe, painless, and effective.
And then, of course, there are the more obvious surgical necessities, where I think owners understand the need for anesthesia, even if they're still nervous about it.
Right. There are some procedures where complete immobility is just an absolute requirement. The most common ones are spaying and neutering.
A major abdominal surgery in the case of spaying.
It is. Removing the ovaries and uterus or the testicles in a male requires deep muscle relaxation and total unconsciousness. And it's worth remembering that besides population control, these surgeries dramatically reduce the risk of certain cancers down the line, so that one-time anesthetic event is a huge investment in their long-term health.
And then you have the really complex stuff like orthopedic surgeries.
Yes, things like fixing a broken bone or repairing a torn cruciate ligament in the knee. These are incredibly precise procedures. The surgeon is aligning bones, placing plates and screws.
There's zero margin for error.
Zero. The dog has to be perfectly reliably still for the entire time. General anesthesia is the only way to guarantee the safety and the success of that kind of intricate repair work.
Okay, so we've established the necessity. Now let's get into the part I think listeners are most keen to understand: managing the risks. While it's generally safe, owners need to know what factors can elevate the risk for their specific dog.
This is so important. This is what empowers you to have that really productive conversation with your vet. And the source identifies a few key factors. The first one is breed predisposition.
Meaning some breeds just handle anesthesia differently.
That's right. And the classic example, the one that requires the most specialized care, is the brachycephalic or flat-faced breeds.
So we're talking about our pugs, our French bulldogs, boxers, that group.
Exactly. Their anatomy is their biggest risk factor. They often have very narrow nostrils, an elongated soft palate, a smaller than normal windpipe. Their whole airway is compromised from the start.
And anesthesia makes that worse.
It can, because the drugs cause muscle relaxation. So those already floppy tissues in the back of their throat can relax even further and block their airway. This makes breathing and ventilation a real challenge.
So what does that mean in practice? How do vets manage that?
It requires a very specific protocol. These dogs must be pre-oxygenated, given pure oxygen for several minutes before any drugs are administered. The intubation, placing the breathing tube, has to be done very quickly and carefully.
And recovery is different too, I'd imagine.
Critically different. The breathing tube stays in place much longer than with other breeds. We wait until they are almost fully awake and actively trying to swallow and push the tube out. Pulling that tube even a minute too early could cause their airway to collapse. It's a huge area of focus.
That's such a crucial detail. Okay, the second big factor you mentioned is age.
Yes, and it's a factor at both ends of the spectrum. Let's start with older geriatric dogs.
So why are they a higher risk even if they seem pretty healthy for their age?
It all comes back to that organ function we talked about. Even in a healthy older dog, the liver and kidneys just don't work as efficiently as they did when they were younger. They have diminished clearance.
So they can't process the drugs as quickly.
Exactly. So if you give them a standard dose, the drug stays in their system for longer at a higher concentration. This makes them more susceptible to side effects like low blood pressure or low body temperature, and it just makes for a much slower, tougher recovery.
Which is why that pre-op blood work is even more critical for them.
It's non-negotiable for a senior pet. And on the flip side, you have very young puppies.
What are the risks there?
Their systems are just immature. Their organs aren't fully developed yet. They have a hard time regulating their own blood sugar and body temperature. So for them, it's all about super precise dosing, active warming throughout the procedure, and sometimes even glucose monitoring to make sure they're stable.
So with age and breed as known factors, the next step is looking for those hidden problems, the underlying health conditions.
Yes. A dog might seem fine at home, but if they have a condition that compromises their heart, their lungs, or their metabolic system, that really shrinks their margin of safety under anesthesia.
Like what kind of conditions?
We're talking about even mild heart disease, diabetes, or chronic respiratory issues. For these dogs, a small drop in blood pressure that a healthy dog would barely notice could become a serious problem.
And this loops right back to the pre-anesthetic screening being the solution.
This is the only solution. The screening isn't just about finding problems. It's about predicting how the dog will react. If we find, say, early kidney disease on the blood work, the whole plan changes.
Right.
The vet will immediately select different kidney-safe drugs. They'll run IV fluids more aggressively to support blood flow to the kidneys. They'll monitor blood pressure even more closely. It's all about knowing the vulnerability ahead of time so you can build a plan to protect it.
So let's do a deeper dive into those safety protocols themselves. We've talked about the pre-procedure evaluation. Let's really get into the details of what those tests are telling the vet.
Okay, so the blood work is usually two main panels. The first is the complete blood count, or CBC. This tells us about all of the blood cells.
Red cells, white cells?
Exactly. Red cells tell us about oxygen carrying capacity. White cells can flag a hidden infection. And platelets tell us if the dog's blood can clot properly, which is obviously vital before surgery.
And the second panel.
That's the biochemistry panel. That's the one that looks at organ function. It gives us those key values for the liver and kidneys we discussed, but it also checks electrolytes like potassium, which is critical for heart rhythm, and blood glucose for metabolic status. It's a snapshot of the entire body's internal engine.
And again, the owner's role in providing that health history is just as important as the blood work.
It's a critical piece of the puzzle. You have to tell the vet about every single medication because so many common drugs can interact with the anesthetic agents. Even something simple like an NSAID for arthritis can affect kidney function or blood clotting under anesthesia.
So the vet needs that info to adjust the plan.
They do. They might ask you to withhold a certain medication for a day or two, or they might choose a different anesthetic to avoid a negative interaction. It's all part of building that safety net.
Okay, so the assessment is done, the plan is made, and the dog is safely under anesthesia. Now we get to the monitoring. What exactly are they watching on all those machines that are beeping?
This is the most active part of the safety protocol. And in modern practice, there should always be a dedicated person, a trained veterinary technician or another vet, whose only job is to be the anesthetist. Their eyes are glued to the monitors and the patient.
And what are they tracking?
The core vital signs: heart rate and rhythm, respiratory rate, and the oxygen saturation of the blood, which should stay up around 98 to 100%. Any little dip in those numbers prompts an immediate adjustment.
And they're using advanced equipment to track this.
Oh yeah. Every patient should be hooked up to an ECG to watch the heart's electrical rhythm for any abnormalities. A blood pressure monitor is crucial for making sure the vital organs are getting enough blood flow. And a pulse oximeter, which is that little clip that measures the oxygen in the blood.
But the source material, and I've heard this from specialists too, points to one piece of equipment as being maybe the most important of all.
The capnograph. Yes, if there's one question an owner should ask, it's do you use a capnograph on every patient?
So what does it do that's so special?
It measures the amount of carbon dioxide the dog exhales with every single breath. And that number is the single best real-time indicator of how well they are breathing and how well their blood is circulating.
Wow.
If that number starts to creep up, it means they're not breathing effectively enough. If it suddenly drops, it's often the very first sign of a serious drop in blood pressure. It's our earliest warning system for the two most common and serious anesthetic complications. It lets us intervene before a problem becomes a crisis.
That is incredibly reassuring. It's amazing how technology has pushed the safety margins so far forward.
It really has. And it's not just the monitoring equipment. The drugs themselves are so much better than they used to be.
How so?
Well, the modern gas anesthetics we use today, like sevoflurane, are hardly metabolized by the body at all. They're mostly just breathed out. This means when we turn the gas off, they wake up very quickly and very smoothly, with fewer side effects like grogginess or nausea.
And the delivery is more precise now too?
So much more precise. Instead of just drawing up a drug in a syringe, we use sophisticated infusion pumps that deliver a continuous, exact, microdosed amount of medication over time. This avoids the peaks and valleys you get with single injections and keeps the dog in a much more stable anesthetic plane.
And the source even mentioned imaging technology as a safety advancement. How does that fit in?
Well, this is about preparation. If we can get a CT scan or an MRI before a complex surgery, the surgeon can see the problem in 3D. They can plan their every move.
So the surgery itself is faster and less invasive?
Exactly. And the less time a dog has to spend under anesthesia, the lower the overall risk. So better planning leads directly to a safer procedure.
Okay, so let's move into the final phase. Post-anesthesia care. The procedure's done. The dog is waking up. What should an owner expect to see when they go for pickup?
The first thing to know is that they probably won't be their normal bouncy self right away. That's totally normal. They might seem a little disoriented, maybe a bit whiny or shaky.
Just get out of it.
Exactly. They're emerging from a very deep sleep. The vet team's job is to manage that transition in a quiet, warm, comfortable space where they can be monitored closely until they're steady on their feet and fully aware.
The source has a great example of this with an older dog, right?
It does. It talks about Max, a 10-year-old dachshund who needed a tooth pulled. His owner, John, was very nervous because of his age. But the clinic did the full workup, used FAR-V fluids, tailored the drugs.
And his recovery was smooth.
Perfectly smooth. It's a great illustration of how proper preparation can make a high-risk patient have a totally routine and safe outcome.
So then Max goes home with John, and the responsibility shifts. What should you, as the owner, be looking for in that first 24 to 48 hours?
Your job becomes active medical manager. And priority number one is pain management. You have to give the prescribed pain medication on schedule, even if they seem okay.
And you need to know the more subtle signs of pain.
Yes. It's not always whining. It can be restlessness, panting when it's not hot, a tucked up belly, or just an inability to get comfortable. If you see that, you need to call your vet.
Okay, so pain meds first. What's next?
You need to be checking the surgical site. A little bit of redness or bruising can be normal, but you're looking for excessive swelling, any active bleeding, or any kind of colored discharge. That warrants a call.
And what about eating and drinking? A lot of dogs seem a bit nauseous after.
They can be. It's best to offer a small amount of water first. Then, a few hours later, a small, bland meal, like some boiled chicken and rice. What you're watching for is a refusal to eat or drink for more than 24 hours, or, more importantly, repeated vomiting.
1 and 2 times might be okay, but more than that is a problem.
Exactly. More than that, and you need to call the vet right away. And the last thing, which can be the hardest, is activity restriction.
No running, no jumping, no stairs.
None of it. They need to be kept quiet to allow their body to heal.
Yeah.
This means short, calm, leashed walks for bathroom breaks only. I know it's tough with an energetic dog, but it's absolutely essential to prevent them from damaging the surgical repair.
This brings up a really important point. While we know complications are rare, what are the absolute emergency symptoms? When do you stop watching and call the vet immediately?
Okay, this is crucial. There are a few red flags. The first is any difficulty breathing, gasping, labored breaths, or if their gums look pale or bluish, that's a true emergency.
Okay.
The second is sudden collapse or profound weakness where they can't stand up. Third would be that persistent, uncontrollable vomiting we just mentioned. And finally, if they're just unusually unresponsive or lethargic, way beyond what you'd expect. If you can't rouse them 12 hours later, something is wrong.
It's so important to have those in your mind, but also to remember, as the source points out, that the vast majority of cases go perfectly well.
They really do. And the source gives us another great example with Bella, a 5-year-old golden retriever.
Her first dental cleaning.
Yes, and her owner, Sarah, was really nervous. But she had a long talk with her vet, who explained all the monitoring they'd be using, the specific drugs, and it put her at ease. Bella had the procedure, woke up smoothly, and was back to normal the next day with much healthier teeth. That is the typical experience.
And that brings us to the final and maybe most empowering part of this, the discussion with your veterinarian. Being prepared with the right questions is the ultimate layer of protection.
It absolutely is. You are your dog's advocate. The source lays out some must-ask questions for any pre-anesthetic consult.
Hey, what's number 1?
First, ask about the specific anesthesia protocol. Why did they choose these particular drugs for your dog? This confirms that they've done that individual assessment we talked about.
Okay. Number 2.
Confirm the monitoring techniques. Ask, will my dog have a dedicated anesthetist? Will you be using an ECG, blood pressure, and a capnograph? You want to hear a confident yes to all of those.
And then you want to get specific about your dog's own risk factors.
You do. Ask, what are the specific risks for my dog's breed and age, and what are you doing to mitigate them? If you have a pug, you want to hear them talk about their special airway protocol.
That makes sense. What else?
Ask them to explain the recommendation for the pre-anesthetic tests. What are they looking for in the blood work, and how would an abnormal result change their plan? This confirms they're thinking ahead.
Right. And finally, you want to look past the procedure itself.
Yes. Ask for a full outline of the recovery process and the pain management plan. You want to walk out of that appointment knowing exactly what to expect and what to do when you get your dog home.
So if we pull this all together, what's the final takeaway here?
I think the big picture is that anesthesia is an incredibly valuable and safe tool in modern veterinary medicine. The safety is built on a foundation of diligent preparation, constant monitoring, and attentive aftercare by both the vet team and the owner.
And the benefits, whether it's treating a painful condition or preventing future disease, almost always far outweigh that very small, very well-managed risk.
Exactly. Your role in this is to be informed, to ask questions, and to work as a partner with your vet. That partnership is what ensures the absolute best and safest care for your dog.
Right. So since we're all about critical thinking here, let's end with a final thought for you to chew on. We talked about how advanced imaging, like CT scans, improves safety by allowing for better surgical planning. So consider this. As that imaging technology gets even faster and more precise, maybe even giving surgeons a real-time view inside the body during the procedure, how might that change our reliance on anesthesia in the future? Could we see a day where procedures become so efficient that the time a dog needs to be under is cut in half? Or even more, dramatically reducing that risk exposure even further? Something to think about. Thanks for listening, the Bark Brigade podcast.
If you want to continue exploring on this topic, visit Dogozilla magazine for healthy dog lifestyle at dogozilla.com.
Wishing you and your healthy dog a happy week.